Suicide. Suicide is a complex and difficult issue, and our understanding of it remains quite limited. Researchers have come to understand that death by suicide involves a combination of a person feeling thwarted belongingness or alienation from others, in combination with the perception that they burden others to such a degree that their death will be worth more than their life, and a learned fearlessness or capability to act. It's the intersection of these factors that lead to suicide. It's also known that connectedness protects those who are in pain and feeling hopeless, and that strong suicidal thoughts occur when pain exceeds connectedness. There are many myths about suicide. Myth number 1, suicide is a selfish act. In reality, those who are suicidal often mistakenly think that others will be better off without them. Myth number 2, suicide is an act of cowardice. We're hardwired for self-preservation and to fear physical pain, injury, and death. Death by suicide is very difficult because it goes completely against our innate will to stay alive. Myth number 3, suicide is always an impulsive act. To family and friends, death by suicide often seems to come out of the blue. But if we had private access to a suicidal person's thoughts and feelings, we'd potentially see a misery that's been there for some time, and a planning process about the death itself. While in some people, suicide is an impulsive decision after a major loss or overwhelmingly stressful situation, in others, pain may have affected them for some time. While it's impossible to absolutely predict or prevent suicide, some actions can be protective or preventive. Most importantly, a sense of belonging and authentic connection with caring others can be a strong buffer against suicidal thoughts and impulses. Maintaining authentic relationships, caring acts, and check-ins over time with your coworkers and loved ones can help prevent a person from ever getting to the point where they feel suicidal and increases the possibility that they may tell you if they do. There are a lot of things that can be helpful when talking with someone who you think might be suicidal. Most importantly, if you're worried about someone, ask them if they're thinking about suicide. Many fear this will plant the idea, but research shows the opposite. You can start the conversation by saying something like, "I've noticed you don't seem like yourself lately." Then mention specific behaviors or changes you've observed, like, "You seem kind of down." You can use active listening skills. Face the person, make eye contact, and lean in. Don't worry about crafting the perfect response. Focus on making the person feel connected and safe. Sometimes it helps encourage them to talk more about using simple prompts like "and" or "tell me more." Your calmness helps them feel safe to open up. One acronym to remember is AWE, and what else? If you encounter silence, don't rush to fill it. Silence gives the person time to gather the courage to speak. It can also help to reflect back what they say, summarizing their emotions. For example, "It sounds like you're feeling sad because you lost someone important." When they share, it's sometimes a good idea to express gratitude, such as "Thank you for trusting me," or "Thank you for sharing this with me." Sometimes it might help to ask more directly based on the fact that many in their same situation might feel suicidal. You could say, "I hear you're going through a tough time. Sometimes people in your situation think about suicide. Are you thinking about suicide?" If they say no but seem distressed, you can reflect their tone by saying something like, "You're telling me you're fine, but I'm seeing someone who's struggling." If they say yes, stay calm. Thank them for their courage and sharing, and let them know that you're here for them. In some cases, it might be helpful to build time and distance between a suicidal person and their access to lethal means, such as firearms, because the intensity of suicidal feelings, although overwhelming, often diminishes with time. So if firearms are inaccessible, the ability to act will become more difficult, buying time for the intensity to subside. If you're concerned about someone who has had a major loss or traumatic stressor, a bout of depression, or increasing substance use, consider offering to hold guns temporarily or explain safe storage to them. You could say something like, "We've lost people to suicide before who seemed like they were doing fine. I've read that it's important to have a plan for firearms in those situations. And I know you own firearms. Can we come up with a plan for safe storage? It helps to build choice and empowerment in the conversation. People in crisis often feel trapped. Offer them options for taking small steps toward relief. No matter how they respond in the conversation, try to provide hope by offering action. Share small, attainable steps. For example, we can't fix everything today, but let's work on the most pressing issue first. Here are some possible options that might be helpful. What steps do you want to take next? It's also important to remind them they're not alone and that you're here for them and care about them. A simple reminder that they matter can be very helpful. Remember, you do not have to be the solution, but can be a bridge to resources. You can offer to help them connect with professional support, such as calling 988, their department's peer support, EAP, or visiting a mental health provider together. No matter what resources you connect them with, it can be helpful to make a follow-up plan. Ask for permission to check in later so they know that you're there for them. Talking about suicidal thoughts and impulses takes a courageous spirit, open mind, and a compassionate heart. It requires us to approach the person we're worried about without judgment and to help reduce shame, guilt, anger, and stigma. The First Responders Center for Excellence is committed to reducing rates of suicide among first responders. Suicide is not inevitable. Prevention is possible. While predicting suicide is still challenging, small interventions can make a big difference. Compassionate conversation, connection, and action can save lives.